People considering private health insurance naturally want to know what their out-of-pocket expenses will be, how they can avoid them, and why they exist at all when they've got private health insurance. Great questions, right? So what is an out-of-pocket cost? Out-of-pocket expenses are also known as gap fees. These exist when a doctor determines their fee is higher than the recommended MBS fee. The gap fee is the patient's responsibility to pay. If you need a knee replacement, which is listed at $1,300 on the MBS list, the government's going to cover 75% of that $1,300 and your insurer is limited to cover the other 25%. But if your doctor charges $1,500, there will be a $200 gap you'll have to pay, unless your doctor has an arrangement with a health insurer like Bupa's Medical Gap Scheme. Our Medical Gap Scheme is a Bupa partnership with doctors to help our members minimise out-of-pocket costs. Participating doctors who opt to use the scheme help their patients experience a gap-free or known gap procedure. It also keeps doctors happy because we're paying them a higher rate than the MBS fee, in return for their specialist knowledge and skills. Our members are happy, enjoying peace of mind when it comes to costs. To find the doctors on board with Bupa's Medical Gap, visit www.bupa.com.au/findaprovider or ask your GP for a recommendation when they're writing your referral. Once you've found a Bupa Medical Gap Scheme specialist, make sure you understand all the costs before undergoing surgery. By law, health insurers are largely only able to cover in-hospital costs, although are trialling new models of care in the community and discussing reforms with the government. Ask your specialist for informed financial consent brochures that you can work through prior to agreeing to a hospital admission, so that you fully understand all costs associated with your surgery. Our Bupa website has a procedure calculator to help calculate your hospital admission fees when using a Bupa Members First or Network hospital. Or call us. We'll confirm what is and isn't covered before you head to hospital. Because when life happens, it's nice to know that costs are covered.